Hello. So I was going to talk about cerebral palsy. Cerebral palsy is a physical and mental challenge, disability that occurs in utero, at birth, or in infancy. There are several different types of cerebral palsy, which are spastic, which are stiff and rigid muscles, dyskinetic, which is uncontrolled movements, ataxic, which is balance and depth perception, and then there's the combination of all three. So the care plan for someone with cerebral palsy would be first to be calm and supportive. Second, for those that do not need to be treated in their wheelchair, we could place them in the dental chair. We do not force the patient into any unnatural positions as it might be uncomfortable and they might not be able to handle it. Third, we should observe the patient to assess for uncontrolled movements, as we'd want to know that with debridement. So we keep short appointments. We could take frequent breaks, and sometimes it might help to give a muscle relaxant prior to the appointment so that they're nice and calm. We do full debridement in several different appointments, or SRP in several different appointments as well, depending on their probing depths. We would talk to the patient as well as the caregiver, as a lot of people with cerebral palsy live in group homes. So it's essential that we educate the patient as well as the caregiver. A power brush will help the person with cerebral palsy, or the aid. It helps with dexterity, and it gets back into places that maybe they couldn't just with their hands alone. Flossers with handles or water picks can also be, good for the patient. But the caregiver, depending on their disability, should be watching and or helping with the oral hygiene at home. Thank you.